the brain literally can strangle the gut. No matter what someone eats, if they are super stressed, they can get debilitating symptoms.
I had no idea that hormones had anything to do with your gut.
I'm obsessed with the gut. 70% of the immune system lives in the gut. Gut health is so much more complex because of these trillions of microbes, right? Which are capable of thousands of functions, from regulating hormones, mental health, all of those sorts of things. When anyone is dealing with a chronic condition, it's so isolating, so debilitating. And knowing that you can empower yourself by making a few tweaks to your diet and lifestyle, I think can be really, rewarding for people.
GLP-1s, so Ozempic, Mounjaro. What are your thoughts on them?
One of the issues that I've got with these is no one is allergic to fibre. People who eat less than 2 pieces of fruit a day seem to have more painful periods. People with endometriosis are like 2 to 3 times more likely to also have IBS.
Hello and welcome to Finally Found, the podcast that's actually uncovering the truth about women's health. I'm Sophie Richards, and if you've ever had that lingering feeling in your tummy that something isn't right, but when you go to get help, you're told it's just all in your head. Well, it's real and you're not imagining it, because that feeling of being off is actually your gut instinct in every sense of the word. Your gut is one of the most complex systems in your entire body, and when it's out of balance, it can show up in so many ways: bloating, fatigue, acne, brain fog, everything. But despite how central it is to our health, gut problems are often ignored, dismissed, or misdiagnosed. And that is exactly why today's guest is here. Dr Megan Rossi, also known as the Gut Health Doctor, is a leading dietitian, researcher, and author who's made it her mission to help people feel better through healing their gut. She's here to help us understand what the gut actually does, why it's so important to women's health, and also what to listen to and what not to listen to amongst all that social media noise. So if your body's sending you signals that something is off, this episode is for you.
It is an absolute pleasure to be here, Sophie.
No, thank you, honestly. So for everyone that's listening or watching, I became obsessed with you after our M&S event. Okay, so I had an M&S event that I almost didn't go to, and I was really stressed, really overwhelmed, which I want to talk to you about in this podcast. And you got up on stage as part of a panel, and I was just in awe of you. And you were speaking, and I was like, I went to you, didn't I, at the end with a list of questions on my iPhone, being like, so is gluten actually bad? Is dairy actually bad? And you were just amazing. So I'm so excited to have you.
Oh, bless you. Thank you. I think I was like, oh my God, I've seen your face on Instagram before, haven't I?
Like, I think I've seen your face.
It's such a weird world, is Instagram, isn't it? It's kind of like,
I know.
Are we actually friends, or are we just like Instagram friends? And
I know. I'd like to think we're now friends.
We are now.
Although you definitely regret giving me your number. Because I text Megan all the time. I'm like, so my friend has thrush at specific times of the month. Do you think this supplement would be a good idea? And you're just like, block. Not yet anyway.
No, we're still friends, don't worry.
Exactly. So I obviously know all about you, but for those of you who don't, please could you give a little introduction?
Yeah, so I'm Australian. Grew up on a farm in Australia, so very different to my life. But it was really, I guess, my passion for the gut that led me here, right? So when I finished studying nutrition and dietetics, I always loved food. I grew up in like an Italian family. I was like obsessed with food. And then I learned that actually food could do you really good. There was that science element to it. And my mom was a science teacher. So kind of those two things like together made me go, oh my God, I want to do this as a profession. So I did the degree, and then I started working as a dietitian, both in the hospital setting, all different types of conditions, whether it was depression, kidney disease, heart disease. But I was also really fortunate to be the nutritionist for the Australian Olympic synchronized swimming team.
My God.
And I honestly think that's because they couldn't afford someone more experienced at that stage.
No,
but anyway, I was like, I'll take this title. So I was seeing very different people, right? Elite athletes, very sick people coming to me, both of them complaining of the gut. I was like, what is going on here? Like, weird. And that was 2010. So there hadn't been a whole lot of really research come to the forefront about gut health, which obviously is exploding now.
But you were still treating people mentally and physically through the gut, which is interesting because it was quite a long time ago.
Yeah. So I was thinking, I was hearing like people's lived experiences and going, well, let's try different things and, see what would work for you. So that's when I was like, I want to elevate this and actually do research in it and see whether this is a real thing we're experiencing, right? So that's when I did the PhD in gut health and looking essentially whether we target the gut through the right nutrition, whether that could help with not just those gut symptoms that can be so burdensome, right? But systemically throughout the entire body. Could we help with kidney function, heart function? And it was that PhD that blew me away. I was like, I'm obsessed with the gut. Like this is improving people's lives in very real but often surprising ways because, like you said, historically it was very treat every organ separately. And I was like, wow, this is connecting everything together.
Yeah.
So that was all done in Australia, and, it's very far away. So I knew I needed to go international to kind of establish my research career. So that led me to the UK, and I still work as a research fellow I've been here for a decade this week, which is, pretty scary. Time flies.
That's amazing. And in Australia, were they piecing together that these organs were connected, or was that something that you actually learned when you were coming over here?
Yeah, no, I think it was, it takes a long time for the research to translate, but there were murmurs, absolutely, in the scientific community showing that actually things were connected. We shouldn't be treating things in isolation, but it just does take so much time from things to be discovered in the scientific lab to actually translate into, the medical profession and healthcare profession, which is why I set up social media to do more science translation, right? Because we were discovering amazing things about the gut. Yet I was seeing people in clinics. So alongside as a researcher, I continued my dietetic practice. And they were really intelligent people going on the craziest diets because they'd heard it was good for the gut when it was literally the opposite of what the scientific world was finding.
Yeah, so carnivore, I'm guessing, is one of those.
Yeah, look, I mean, the carnivore diet, I think there's just so much misinformation, and everyone, I know you're really big on the lived experiences, and I could not agree more. But the thing with the carnivore diet is that if you have a sensitive gut, the truth is it will in the short term make you feel better.
Yeah.
Right? Because it's taking out, we call them stimulants. So fibre, I know we're probably diving in too fast, but fibre, the backbone of all our plant-based foods, right? It is essentially a fertilizer for the trillions of bacteria that live in our gut, right? Yeah. So it's so beneficial for them, but it does activate them. And if you've got a very sensitive gut, like if you've got IBS, then that activation can actually trigger some uncomfortable feelings in the gut.
Yeah.
So cutting out all the plants in the short term might feel like the solution because it's not activating your gut. And you're like, well, I'm not getting the symptoms.
Yeah.
But we know through so much evidence that if you're cutting out plants in long term, things like hormone regulation, mood, longevity, all of these things are just so incredibly important.
Yeah.
It'll take its toll on it, and you won't be thriving, a couple of years later.
I'm so excited to get into one, what your perspective on what the best diet is, but also the myth busting stuff. But before that, you talk about a gut and sensitive gut. Some people might have no idea what the gut is. I remember before studying, I just thought it was my stomach issue. It was my stomach, and actually it's completely different. So can you just differentiate between tummy problems, gut, and what the gut even is?
Yeah, no, really good question, right? So if we think of gut and gut health, it is this 9-meter long tube, literally 9 meters coiled up in each and every one of us. So along that 9 meters, we obviously have the food tube, the esophagus, then we've got the stomach, then we've got the small intestine, and then the large intestine. So 4 different parts to it. And, some people can feel pain or discomfort in different parts, of that 9-meter digestive tract. But when we talk about gut, think of this 9 meters, right? And that 9 meters is incredibly important for so many things. But, I think if we boil it down to 3, one is the digestive system, an obvious one, right? If you don't have a good gut lining, you can't get the food from this hollow tube into your blood to feed all your other organs. So that's the first one.
Yeah.
To make the most of what you're eating, you need to have good gut health. The second one is your immune system. Yeah. So I know we've chatted about this before, but 70% of the immune system lives in the gut.
Which is crazy, isn't it?
Yeah. And it's why we see all these autoimmune conditions and things, and even cold and flu, people have more resilient gut health, are less likely to get sick. So we've known that, again, for quite some time. But it's really, I guess, the third element of this 9-meter long digestive tract that's brought the fame and the excitement, and certainly, what we study at King's, and that is the gut microbiome. So scientific word for you, but it is these trillions of microbes, mostly bacteria.
Yeah.
But actually, not to freak people out, but there's some fungi such as yeast and viruses which form part of your gut microbiome, which synergistically work together. So we shouldn't fear all viruses and, fungi and yeast. Some of them can actually have potential health benefits, right?
And should be there.
Yeah, absolutely.
So weird. It's just creepy to think about it, that we've got this tube inside us full of bacteria. But it also goes to show, if there's hundreds and thousands of them there, or trillions even, keeping a delicate balance of those being in the right place and not having too many of the good or too many of the bad is such a really hard dance to do in the environment that we're in right now. And we'll get into the things that can help your gut or hinder it. But what are some of the symptoms if someone's having gut problems? Because I think half the time, or at least my problem with the endometriosis diagnosis that I struggled with, was I actually didn't know what to ask for help with, because I was like, my stomach is hurting, my stomach. And they were like, oh, maybe she's got an acid problem. But what I was actually trying to say was I was having gut problems. I was having ovulation problems. I was having problems with my womb, for example. So what do gut problems actually look like in someone?
Yeah, I mean, it is a brilliant question. And again, historically, we would have said a sign of poor gut health is digestive symptoms, from bloating to stomach pain to altered poops, those sorts of things.
Yeah, like constipation, diarrhea.
And then the mixing between them. We would say exclusively that. If you didn't have them, then you must have good gut health. There's no issue there, right?
Yeah.
But actually now we appreciate gut health is so much more complex because of these trillions of microbes, right? Which are capable of thousands of functions, from regulating hormones, mental health, all of those sorts of things. So it goes beyond just digestive symptoms. So certainly when I'm seeing people in clinic, you know, historically it was only people with digestive symptoms would come to see me, and now it's people, you know, with low energy, low mood, sleep issues and things like that. So I did, when I was writing my first book, develop this 10 question assessment to give people a better idea of where their gut health is. So we can add it to the show notes, but essentially it's things like obviously the digestive symptoms, but how often are you getting sick? How are you sleeping? Are you on medication? Are you on a restrictive diet? All these types of things. Are you having, you know, hormone issues? All these types of things kind of build a story and makes me think, okay, well, actually maybe it is worth focusing on, you know, nourishing your microbiome and seeing in 4 weeks, has that improved that symptom that we were looking for?
It's so interesting, because I bet you there are so many people listening that are going, oh my God, I've got acne problems. And I was always told it was what I was putting on my skin. That was the biggest thing with me. I was like, I must be dirty, I've got acne. Things like endometriosis, going, oh, it's just, this was my thing again. And a lot of people I speak to online, I've got endometriosis, it's potluck, and I've been dealt this deck of cards. And not realising that actually lifestyle factors can be helping or hindering your gut, which then has a knock-on effect on endometriosis. So I want to dig into the hormone connection, because again, before doing some of my training, I had no idea that hormones had anything to do with your gut. So can you talk to us a little bit about it?
Yeah, so it is, again, another really exciting space that kind of makes us think, well, actually, maybe these microbes are in control of more than what we realize, right? It's a bit, you know, humbling for the human ego that thought they were in control of everything. And we're like, actually, maybe these guys are kind of doing a lot. So in terms of the hormones, and I also, let's touch on acne, because I think that is a very interesting one. And I think there's a lot of myths around that space. So in terms of our gut microbes, what we've discovered is that actually there's certain types of microbes that can turn inactive estrogen into active estrogen. So essentially when we have used the estrogen in our body, it gets dumped in our gut. And normally that would just get pooped out and then that's gone, right? But now we know there's a group of bacteria known as the estrobolome, another scientific word, to make you, you know, if you want to share with your friends, but oh yeah, the estrobolome, I know all about that during a coffee. So these microbes actually can, you know, prevent it from being wasted and turn it back into active estrogen. So we know, and actually it's not just estrogen, other things like progesterone and testosterone, we know microbes are also having a really important regulatory role. So again, it's highlighting that these microbes are doing a lot more with our hormone regulation, but also it works twofold, right? So, or the other way. So we know that hormones, like, you know, people going through, you know, pregnancy or, you know, menopause and different, you know, conditions like endometriosis and PCOS, again, those hormones can also impact those microbes. So it is dual directional.
A loop.
And I think what we're trying to understand, and we don't know yet, is like, what is the underlying cause? And I don't think it's going to be that your gut caused your endometriosis, right? I think there's going to be more genetic factors, and maybe there's environmental factors that turn certain genes on and then also may interfered with your microbiome to some extent. But certainly what we know from the science, but also what I see in clinic, is that absolutely, like you've said, focusing on diet and lifestyle factors can empower people to actually improve some of their symptoms, not cure it, but actually improve. And I think when anyone is dealing with a chronic condition, it's so isolating, so debilitating. And knowing that you can empower yourself by making a few tweaks to your diet and lifestyle, I think can be really rewarding for people. And I think that's why it's so important to kind of get the right information out.
I think the whole switching on and off hormones and recycling them was such a mind-blowing thing for me to learn, because you think, okay, your body's detoxing estrogen, goodbye. And then you've got maybe these microbes that aren't too happy going, no, thank you, we're going to reactivate it. And when you think of the hormones that you've talked about, estrogen and progesterone especially, they are like a huge part of your menstrual cycle. So if you have a period, going through perimenopause, going through menopause. And so if your body is naturally going through these processes and going, brilliant, let's surge this hormone now and time to detox. But then your gut is going, no, we're going to go again. Of course, that's then going to have an impact on your period, on your perimenopause or menopause, or I assume it does anyway. So like you said, doing lifestyle changes and helping that gut and maybe supporting your period or your transition through menopause would be huge. Do you have people that come in to the clinic or in your research where you've been directly able to say their period, perimenopause or menopause was made worse or better by their microbiome?
Yeah, by nourishing it, like absolutely see in clinic. But, we also have the science, right? So there's been studies out there showing associations of like people who eat less than 2 pieces of fruit a day seem to have more painful periods.
Yeah.
Because we know
less than 2,
less
right?
than 2
Which
pieces.
When we talk about some of and blood sugar balancing is so important, but fruit isn't the enemy. Like fruit juice, maybe not too much of it, but you always talk about fruit with the skin on and the meat and everything with the fibre. Yeah. So interestingly, increasing your fruits, which is something people have been restricting, is one of the best things you could do.
Absolutely. And it's because it not only contains all these different types of fibres which nourish those microbes, but also these other chemicals called phytochemicals. There's literally tens of thousands of them. And they, again, have all these anti-inflammatory potential benefits. So that's what I think one of the dangers of social media is, that people then fixate on blood sugars, cut out because like fruit has got sugar in it, and don't realize actually in its whole form, it's got so many other beneficial things that would outweigh any sort of potential negative impact of having a little bit of natural sugar, right? So I think, that's a really important one. Same with like people cutting out fat. We know, again, through studies, they've connected people who have extra virgin olive oil every day seem to have lighter periods. So people who struggle with really heavy periods, again, that might be something to think about as well.
It's incredible because again, we're always told fat is bad, whether it was you grew up in like skinny culture where it was like fat's going to make you fat, which to be fair, the name does not lend itself well.
It does not.
But when you learn about, like, I had no idea that fat makes up a lot of our hormones, and without it you literally can't make enough of the hormones that you need, and then we wonder why our hair is thinning or falling out or our acne is going wild. On the note of acne, something you said which I loved, because I definitely got caught up in the social media thing of then being convinced my gut was controlling everything and that my gut was the source of everything, and it was like me versus my gut. And then you, as a gut health expert, was like, you can't blame the gut for everything. So please, can you talk a little bit more about that?
Yeah, look, I think it's one of those things where people can get carried away, right? So we know this is a landmark scientific discovery. Our gut is incredibly powerful. It's doing so many things, but we can't blame it or think it's a solution to everything. That's where like the science comes, in, where we need to actually look at the science and go, okay, what things actually have more of a genetic component or, a hormonal component? And acne actually is one of those things. So yes, we know that our skin microbiome, so we don't just have these trillions of microbes in our gut, we also have a skin microbiome, so billions on our skin. And actually it's those skin microbes that are having a role in acne, which is why, some of the first line medical therapy is, antibiotics or topical antibiotics and things like that. So it really does change how our kind of microbes work on our skin. But certainly when we look at all the studies out there, they haven't shown that nourishing the microbiome is going to cure acne. Yes, if you've got a super ultra processed food diet where you're not feeding the microbes, you're starving them of their fibers and those phytochemicals I mentioned, then actually, yes, that could aggravate your acne and maybe worsen it by 15% or so. But it's not the sole cause.
No. And it's that thing of, you were talking about the recycling of hormones. And if, for example, constipation, it's my favorite topic because it's me versus constipation all the time. But if your detox system, so literally going for a poo, isn't working, and in that same place you're meant to be recycling, detoxing hormones, but it's all stuck in that area, as like an indirect effect, it could be worsening your acne, but it's not the reason you've got it, is what I'm hearing.
Absolutely.
Yeah.
Yeah.
Okay, fascinating.
Yeah.
One thing that I'm hearing all over TikTok, and I'm fascinated with it because I recently had a test that came back that I had H. pylori. Now, this test didn't show which strain. So I'm now doing further testing to find out which one, because apparently you need antibiotics for some and some you can do through diet. But there's a lot of talk and noise on social media about H. pylori being the root cause of so many people's acne. They go on this huge course of antibiotics, which is quite extreme, and then overnight they haven't got acne anymore. What are your thoughts on that?
So we know H. pylori is a very common stomach infection, right? Okay. So if someone has, ongoing reflux, often they get tested for H. pylori in their stomach. So it's a really important one to, if you do have it, get cleared, because it can increase risk of things like stomach cancer.
And how do you get it?
You just pick it up,
Brilliant.
Yeah. Millions of microbes floating in the air, right? So, and it's everywhere we go, weird. We touch them, and so there is that. But in terms of this concept that H. pylori is the underlying cause of acne, that is a myth we need to squash, because it's just not true.
Yeah.
It's as simple as that. Yeah.
Yeah. Okay. Well, I am going to try and get rid of it, because if I do have it, I know it's something that doesn't actually clear itself, right? Like, you've got it and you have to intervene in some ways.
Yeah. You want to make sure it's kind of in your stomach. Definitely worth investigating and checking, but it's not, there's no link between like reflux and acne. And we know that H. pylori is kind of one of the causes of certain types of refluxes anyway. So, if I wish acne was that simple to cure of just being one type of strain.
Me and you too.
It's like, definitely for me, I've struggled with it, lifelong. And it's a genetic thing. It absolutely is. And yes, obviously, like we said, nourishing your microbiome, de-stressing, all those sorts of things can help manage to some extent. But we can't avoid the fact that there is that strong genetic component, hormonal component, that time of the month, all that sort of stuff. So there comes a point where there needs to be a level of acceptance.
Yeah.
And, I do believe in the future there will be a topical probiotic for acne. And there is some research looking at specific strains or types of bacteria that might have a benefit, but it's still kind of in clinical trial stage. So fingers crossed, I will certainly let you know.
If you bring out something which is going to clear my acne, take all of my money. I'm the same, right? It would be dreamy. Can you imagine that? Can I ask, before we move on to something else, because now we're on the acne topic and I'm selfishly asking questions.
No, bring it.
Roaccutane. I went on Roaccutane when I was 17 years old. Yeah. My sister, so definitely genetics, my sister and my brother had raging acne. Yeah. My brother's just cleared on his own, but my sister went on Roaccutane for quite a long time. Baby skin now, amazing. I went on it for 3 months, woke up one day, felt like my body had been in a car crash and was like, I think I'm dying. Like, what is going on? Doctor had to come out to my room and was like, what medication are you on? And I didn't count skin medication as affecting my health. So I was like, nothing. And they happened to be on the side. And he was like, the side effects of this drug are really serious. And something to do with your muscles. It was basically, it wasn't quite muscle paralysis, but it was basically where like you can't use your muscles properly, hence not being able to get out of bed.
Right, okay.
But something that happened at the same time, which is why it's really hard to pinpoint what it was. Yeah. I was 17, I got my first period. I also went on Roaccutane, was having all of these problems with my tummy. And a lot of people talk about going on Roaccutane and now having disrupted gut or leaky gut. Have you seen research or have you experienced people with Roaccutane now having a dodgy tummy? Because I'll be totally honest with you, I'm considering Roaccutane if I can't clear it naturally. Yeah,
look, I mean, I wouldn't say I've seen any literature that's connected the two. So Roaccutane obviously being a medication, very high dose vitamin, vitamin A. So, but again, there's still so much we don't understand about different medications. But I would say I'm not aware of any connections of gut issues and Roaccutane. And like you said, there was a lot happening, your
so much
hormones raging.
17 was not a good time. Say that now.
And that's a lot to go through when you're 17, right?
Yeah, it was. But everyone has that period of their life where they're just like, what the fuck is going on? Yeah. It's all happening at the same time, which is always how it works, isn't it? It's like a chain reaction. Yeah. Something I find fascinating as well is how, and again, it's just like a light bulb moment, was I always knew that if you ate something bad, I put in quotations, there's no good or bad food, but if you're eating a super ultra processed,
low nutritious
diet, exactly, that it would make your tummy bad. And I always thought if I was stressed, I'd get a bad tummy. So I kind of knew that there might be a gut-brain connection in terms of I'm stressed and it's making me have an anxious belly. You know, like in Wales, we have something called the Eisteddfod. Imagine the Olympics, but it's for like poetry, clog dancing and music, right? It's a real thing. It's genuinely a real thing. Google it. There probably is a video of me clog dancing on the internet somewhere. We will try and find it one day.
You're such a nerd. I love it. That is... We need to see it.
I'll wear my Welsh top hat next time. There was a full outfit. Anyway, we digress. Before going on stage, I used to have to sing as well, and I really wasn't that great at it. And I used to have these nervous butterflies. It was a wild time. Nervous butterflies in my stomach. And I'd be like, oh, it's because I'm stressed. And that's kind of like an accepted thing. What I didn't know was that it can go the other way. So like your brain can text your stomach, but your stomach can text your brain too. So please, can you explain it in a much better way than I did?
I love that. But like you said, everyone has experienced that gut-brain connection, right? Yeah. But all the focus has been the brain impacting the gut. And we know that the brain literally can strangle the gut. I see it in clinic all the time where no matter what someone eats, if they are super stressed and they've got IBS, so the underlying kind of gut-brain dysfunction, you know, they can get debilitating symptoms, right?
Strangling the gut. That is such, it's like when you're wearing like jeans too tight for you, but that's all you've done is like eat an apple. Like, why is it happening? Yeah, absolutely. So we know, you know, everyone's experienced that, right? But what the science has now uncovered is this extra new element, and that is those gut microbes. So there is hundreds of millions of nerves that connect the gut and the brain. So we know there's this pathway. Scientifically, it's called the enteric nervous system. Don't need to worry too much about the names, but so we know it's kind of this live wire connection going on there. Yeah. And these microbes, like I said, this kind of new element to it. And there's three main ways we think these microbes are influencing what's happening in our brain, right? So one is when we eat food, those microbes, like I said, the plants, the fibres, break that down and produce different chemicals that then gets into our blood, and some of them can pass that blood-brain barrier, kind of like a postal service mechanism, right? The second one is the vagus nerve. So a lot of people are starting to hear this vagus nerve, and that's kind of like a mobile phone. The microbes literally sense something's going on because they're really sensitive. They phone up the brain, say, look, this is happening, you need to release this, blah, 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 right? So that's the mobile phone pathway. And then we alluded to the immune system. So the immune system can get activated by those microbes. They can activate it again if the microbes sense something's going on. They need to tell the brain, they activate the immune system. The immune system can then produce all these different inflammatory markers, which then have their impact on the brain. So it's kind of like an alarm system. Yeah. So you've got the postal service, the mobile phone, and the alarm system. So that's kind of how these microbes are impacting an organ, you know, in this isolated skull, sort of. So a very different part of the body. It's wild. It's like having like a million tabs open, trying to like sieve between them all. Yeah. And inflammation is actually a good thing, right? It's meant to be a protective mechanism. But when it basically doesn't leave your body, you're just left with that brain fog where you're just like, I have no idea what's going on. And it's so interesting learning how it's not just the stressful day that we've had, it's what we've eaten might be making us stressed at the same time, which is such a weird concept.
Yeah. I mean, a lot of people don't realize that, and they're like, any sort of stress is terrible. Yeah. Like, but actually it can be really healing, and we need a bit of stress. Yeah. Right. You know, when we go do a HIIT session in the gym, that can be stressful for the body, but actually we know the benefits outweigh that. Like you said, it's the chronic, the ongoing low grade levels of stress where there's just constant inflammatory markers, and the body's just like, okay, I'm so tired. I have not had time to rest without all these inflammatory markers telling me to do certain things. Yeah. And that's, like you said, when it can get really dangerous. And we know that, again, these microbes, when they eat the fibre, obviously I'm obsessed with fibre because it is so important. And I think we hear it from the government guidelines, we're not getting enough fibre. It's so boring. Like people just switch off, but literally it is fertilizer for them. Yeah. Like human cells can't digest fibre. So we've got no purpose. It literally is just for them to eat. And when they eat it, they produce these things called short chain fatty acids. So people are starting to hear things like butyrate, and they have these like anti-inflammatory benefits. They help strengthen the gut lining, you know, reduce the gut leakiness. They can even help things like regulate hormones and all that sort of stuff. Yeah. So again, we know that they can really help with, you know, inflammatory issues. Yeah, this is something that I'm like absolutely fascinated by. And I remember the first time we met, I was like, by the way, I'm writing a book about inflammation. I want to talk about the gut. And one thing that I think has always been conflicting in my mind is that we have this system, right, where we know that we need more fibre to help our hormones. And so if you've got
irregular hormones, your PCOS is all over the place, your endometriosis is all over the place, you're having a really shit time going through menopause, and then you eat an apple and you get bloated, but then you're told that fibre is your friend, but you eat fibre and you're like, now I'm constipated, and like you said earlier, stomach feels strangled.
Yeah.
You're then like, well, I'm trying to do good, I'm eating that salad that we were obsessed about in M&S, I think it's like a 36 plant salad or something crazy, and you're like, but why am I now bloating with all this healthy stuff? So I think now would, one, be a great time to explain why that happens, but two, look at some myth busting, because it's like, okay, so why is fibre making me have a bad tummy if it's so good for us?
Yeah, I mean, it's such a contradiction. People get confused, and that's why the carnivore diet's kind of risen, because people are like, I'm just allergic to fibre. And I'm like, no one is allergic to fibre. You need to think of your gut kind of like any other muscle, right? You need to train it. So like if you want to hit a PB at the gym, you don't just expect that you're going to do it overnight, right? You train your muscles, or a marathon, like, you know, you practice and you work your way up and you build your way up. The exact same thing happens with our gut and fibre, particularly if you have an underlying sensitive gut, right? So it's a case, I know it can be really boring, but whatever food you find, you know, that it's the apple, or maybe it's legumes. So chickpeas, butter beans are often, common ones, because they've got a specific type of fibre that the microbes really love, but the microbes kind of binge eat on it.
Yeah.
So those sorts of foods that you might find as a trigger, literally having 1 tablespoon every day, religiously every day. So just get a can and then keep it in the fridge. Every day have it. Yeah. And what happens is it trains your gut and your microbiome to break down the fibre more efficiently and actually absorb some of that gas. So we should probably talk about why people get gut issues. So when we think of breaking down that fibre, right, they produce those amazing chemicals, the short chain fatty acids, which we all want more of. But then they also do produce a little bit of gas as a waste product.
So a little bit of like bloating after food is actually normal.
Yeah,
because
absolutely.
Of that little gas.
A high fibre meal, absolutely. Yeah. So it's completely fine. And what normally happens in a healthy situation is that actually a lot of that gas gets from our gut into our blood system and we breathe it out.
Is that visual bloating? Can you see your stomach going out? And should it be uncomfortable? Or is that actually a sign that something might be off?
Yeah. So there's different types of bloating, right? So like I said, if you have a really big high fibre meal, big bowl of beans, you might visually be able to see a little bit of bloating, and it shouldn't be disturbing, right? But like you said, a lot of people can have burdensome bloating where they'll have the beans and get like really a lot of pain and tight and all that sort of stuff. So that's when you go, okay, you've essentially run a marathon without training your gut or your muscles. You've overdone it. It's not like you're allergic to them. You just have overdone it. So what you need to do is taper back. The next couple of days, you would really reduce having any of those legumes if that was the trigger. Yeah. And then you would go back and go, okay, I'm just going to have the tablespoon. Yeah. Right. And it's training the microbes. Because like I said, in a normal situation of a trained gut, what happens is a lot of that gas gets absorbed, we breathe it out, or the microbes actually can break down that gas further. So actually very little comes out the back end. Yeah. But if you've got this underlying sensitive gut, then not much gas can get through and it gets kind of trapped inside. Yeah. And the microbes might be unbalanced, and therefore you don't have a lot of the gas eating bacteria, more of the gas producing ones. Yeah. And all of that sort of stuff can be at play. Yeah. But again, it comes in, if that's you, it does suck, but you just need to train the gut that little bit more. Yeah. Right. So I think that's definitely the way people need to view it, because we know cutting out these foods leads to just worse symptoms in the long term, and you're not getting those inflammatory benefits that these foods have, been shown in so many studies to deliver.
With the keto diet, fasting, carnivore, all of that stuff, went down an absolute rabbit hole with it. And this was before, have you heard of Dr. Mindy Pals? She talks about, her book is Fast Like a Girl. Okay. Yeah. And prior to that book coming out, I was like, every day is the same. My cycle does not exist. It has no impact on me. I should do everything like a man. And I was following this guy on YouTube. And to be fair, I had no water weight. I had no pain. But then after a while, I had no energy. I felt worse. I just felt really low. And then my acne went wild. It was like wildfire. And it wasn't like cystic acne like I was used to, or hormonal acne that would pop up and down. It was like micro, like pussy spots all around my mouth. And someone said, like, do you think it's the keto diet doing? And I was like, no, it's impossible. It's an anti-inflammatory diet. But actually, like you said, I wasn't giving my gut anything. And so I wasn't helping my hormones, which wasn't helping my acne. And long term left me with probably more of a damaged gut than I started with. And even though now I wouldn't do a low carb diet or intermittent fasting, I know that some people are hell bent on doing it. And so if you are listening and you're that person, I would recommend Dr. Mindy Pelz's podcast and her book, because she talks about how there's certain points in your cycle where if you cut back on your carbs, like pre-period, you're not giving your progesterone that injection it needs. You're not going to have a nice cycle. And it's so, so difficult. But when it comes to building the strength in your gut, first of all, why do we even have poor guts to start with? Like, why is everyone having a bad time with their gut, men, male or female?
Yeah, look, I mean, we do certainly see that over the years, because we've moved away from a lot of home cooking and home grown foods, actually we have lost some microbial diversity, which essentially means we've lost some of the different types of bacteria. And if you think of each bacteria as having different skills in your body, right, then that essentially means we've lost some functionality of these microbes that used to like look after us. So, having these ultra processed foods, again, I'm not someone who's like, you have to cut them all out because that's just ridiculous. Like, we live in a very different world. Like, we're all so much busier. We can't just cook everything from scratch. That's just not realistic.
Yeah.
But we need to just be aware that they do, often contain less of the fibers. Even if they're fortified with like one fiber, there's like close to 100 different fibers that we would naturally get in foods. All of these phytochemicals, which often get damaged when the processing happens, right? So it's just not going to be as nourishing for our microbiome.
Yeah.
And each different bacteria likes different types of fertilizers as well.
Okay.
Different types of fibers. So yeah, that's, I think, one of the main reasons why we're seeing a lot more people just having gut issues, as well as, we're in a more stressful time, social media, all of this sort of stuff really does actually feed into this increased strangulation of the gut. So I think it's the microbes changing, it's the more top-down stress strangling the gut, medications, those sorts of things. Also, a lot more people are on medications, and we know some of them obviously super important. I would never recommend anyone stop medication. They can be life-saving. But I think sometimes we're overly reliant on medications when actually it could be like, sleeping pills, right? It could be a case of you just need to focus on your sleep hygiene, turning the phone off 2 hours before bed, making sure you're at like 16 degrees for optimal sleep, and having a worry dining, those sorts of things we know, again, in clinical trials have shown to increase sleep quality. But I think it's just easier to get a sleeping pill.
Yeah, so basically where we're using supplements or medication as a luxury, we should just be working on the real stuff. And also it makes you feel so much better having that routine. You don't just sleep better. You have a 2 to 3 hour window where you're like, oh, this is really nice. I'm quite relaxed. And something that we spoke about before, we did an Instagram live a couple of months ago, was about chewing your food. And I didn't realize, like, I'm so bad at putting Netflix on or scrolling on my phone whilst I'm eating. And then 3 minutes has gone by. I've wolfed down my entire lunch and I'm wondering why I have digestion issues.
Yeah, no, we know that chewing it's such an underrated thing. And as soon as I see someone in clinic and they're like, okay, I just want you to focus on chewing, they're like, you're kidding, Megan. Like, I've had digestive symptoms for like 10 years. And actually there's been quite a few patients where they've trusted me. I'm like, just do it for a week, please. And then, we'll come back and we'll look at more of the, intense low FODMAP diet, all those sorts of things. But like low hanging fruit first, right? I'm trying to make your life easier. They've come back and been like, oh, goodness me, like, this is wild. My symptoms have dramatically improved, like by 75% just by chewing, right? Because we don't physically break it down. We obviously, that's one element, but we have the enzymes in our saliva which start to chemically break it down. So it starts to like pre-digest it. And what we know is if you're not chewing, you're just swallowing, we get loads more malabsorption. So I spoke about that 9-meter digestive tract, right? So just recapping on a bit of science, if anyone loves that element of it. So we obviously have the food pipe. Then we've got the stomach, like a washing machine, literally chucks the food around, the acids, detergents, kind of cleans it, makes like this slurry, and then it gets into the small intestine, which is where most of our nutrients get from our gut into our blood system. Okay. But anything that doesn't get absorbed there, because maybe we haven't chewed right, will make its way into that final 1.5 meters where the microbes live. So they chew away at any malabsorbed food, like the fiber, which is beneficial. But if you're malabsorbing all other nutrients like fat and protein, then actually that can have a negative impact, and they over ferment it and you get the gas and all those uncomfortable symptoms.
And not getting the nutrients from the food because it's not actually having a chance to get access to it, which is probably why there's so many people changing their diets and not seeing the benefit. It's like they're not actually accessing it.
Absorbing it.
It'd be like trying to drink the juice and not taking the lid off. You're just not actually getting to it. On the note of chewing, how many times am I supposed to be chewing before I swallow?
Now, there is no magical number because obviously it depends on what you're eating, right? If you're having soup, if I'm going to say you need to chew that 30 times, you're like, are you kidding me?
Yeah.
Well, so one of the studies I was referring to looked at nuts, right? And they compared if you chewed nuts 10 times versus 40 times. And it was the 40 times that had the most absorption. But what I would say, if we're thinking more practical, because no one's going to go from 10 chews to 40 chews overnight, they'll just go crazy, is to think, okay, from baseline, how many times do I chew my food? Just like count it.
Yeah.
And if it's like 8 times, then I'd say, okay, this week I'm going to add 3 extra chews to every mouthful that I have, and then see how you go the next week. And I'd say try work up to like 20 to 30. Again, depending on the texture. If it's nuts, try go to 40 and see what works for you.
Yeah. So slow and steady, same as fibre, a little bit often. And it's how you build sustainable changes, right? And actually makes a difference.
100%.
Just pausing the episode to say a big thank you to the sponsor of this podcast, Boira. If you followed me for a while, you know I'm all about natural pain relief, and their TENS machines are genuinely amazing. My go-to is specifically the Boira EM50 TENS machine with heat technology. If I'm having an endo flare-up or cramping from my period, I just pop it on, and the combo of the TENS technology plus heat therapy is pure bliss. I wear it at home, on the go, and it's an absolute dream for flights, and I recommend it to everyone I know who wants non-medication support for pain. And if you want to get your own, you'll find the link to the Boira EM50 in the show notes, and make sure to use the code FOUND at checkout. It's your exclusive listener discount. And now let's get back to the episode. We've talked about chewing. We've talked a little bit about fibre. Can you dig in to some practical steps on how to increase fibre? Because you've got like a Super 6 method, right? Where you're like, this is what I go, and I love it.
Yeah, so when we talk about fibre, I think a lot of people just think of fruit and veg, which is understandable. That's what the government guidelines are doing. And actually at King's, we've actually just received a grant from the government to have a look at the different types of plant-based food groups, because I think we've definitely just been neglecting them, and they're so important because I alluded to it before, but each different type of plant provides our body with different, or our microbes with not just... So our microbes are different fertilizers, but also different micronutrients for the rest of our body, right?
Yeah.
So there are 6 different plant-based food groups.
Yeah.
I'm not going to quiz you to see if you remembered them. You're like, oh my God.
Sweating.
So we've got the whole grain. So things like your oats and your barley, your quinoa, your wheat.
Yeah.
You've got your fruit, your vegetables, your legumes, so things like your chickpeas, butter beans, your nuts and your seeds, and your herbs and your spices. So optimally, if we're thinking we're really trying to nourish as many different types of bacteria, is trying to get something from the Super 6 each day.
Okay.
And I think that can just be a really good mental check, like at the end of the day, thinking, oh, which group did I miss out on? And okay, I'm going to have like takeaway for dinner tonight, but let me just get a can of mixed beans. Or if you're really sensitive, just 1 tablespoon.
Yeah.
And that can just, again, add that little bit of extra goodness. And over time, what happens is actually you start to crave it. So we don't just have, our taste buds. We have, again, millions of bacteria in our mouth called the oral microbiome. And they also are thought to play a really important role in our taste sensation. So for people who are like, I need to eat more plants, but I just don't like them. I prefer the Macca's route or something. Then I can assure you, not only have I seen it in the clinical trials, but in clinic and with my own husband, over time, it might take about 9 weeks, your taste buds and your microbes change to make you more plant loving. So sneaking them in if you have to, whether it's like, frozen cauliflower and smoothies and like lentils and bolognese, that sort of stuff, sneak them in. And then over time, you'll be like, actually, I kind of feel like I want more plants.
Yeah. If you're listening to this and you're going, no, I just don't like them, I'm living proof of this. When I went through the autoimmune protocol, which is, I know, quite an extreme one where you restrict for a period of time and then slowly increase things back into your diet and see what your trigger is. Part of that was I was only allowed fruit, veg, and meat and fish. And I thought, okay, well, what am I doing with my sweet tooth? Because I like dark chocolate. I'd like the healthier treats. But I was like, now I'm stuck with some fruit. And you were allowed medjool dates. And honestly, I was to put them in my mouth. I'd be like, that's disgusting. It tastes like earth. Now, I was literally in Marrakesh for a week and there was a chocolate tart on the table. and someone had flown from Dubai with the juiciest medjool dates and nuts inside, there was not a question in my mind which one I wanted. And if you would have told me back in the day that I would have made that choice, or even craving fruit as my form of sweetness rather than the cake or the biscuits and things like that, I had no idea that it would genuinely do that. Again, proving that your gut is speaking to your brain and that over time your taste buds change.
100%. Yeah.
So interesting. So we've got fibre, we've got chewing the food. Any other little tips that someone right now could do? And also the chewing one, everyone tonight listening or watching, please for your next meal, whether it's the evening or breakfast, give an extra 5 chews.
Yeah.
We'll see what
Do
happens.
it for your microbes. Do it for the nutrient absorption.
Yeah. But a couple of things, yeah.
You did mention before about tight pants, and actually there is a condition called tight pants syndrome. It's in this medical journal, I think it was in the 90s. And, again, we see it in clinic where if you're constantly in your gym leggings and you've got a sensitive gut, that physically can strangle your gut. So if you've got this sensitive gut, obviously wear your leggings to gym, but then don't go to brunch after. Change them, get in the comfy pants.
Yeah.
Those sorts of things, I think, is another really helpful one. And then, the other thing is, along with the lines of the Super 6, is just diversity at the supermarket. Don't just buy your blueberries. Get your mixed frozen berries, right? Don't just get your pumpkin seeds, because each different type of plant has different fertilizers to feed your body. So it's such a simple one that is going to not cost you anything or any extra time, but can have a real measurable difference on your gut health and overall health.
Yeah, I love that they are all natural things, and I'm so for holistic health or nurturing yourself with food, because food absolutely is medicine. Right now there is a big hype about prebiotics, probiotics. So is it a myth that they're good for you? And if it is, please tell us. If it's not, what should we be taking?
Yeah, so a really good one. So prebiotics and probiotics sound very similar. They're very different things, right? So prebiotics is biotic is the fertilizer essentially for those microbes. So we mentioned about legumes, so butter beans, chickpeas. They're really high in prebiotics.
Okay.
So it's a type of galacto-oligosaccharide is the scientific name for it, but it's a prebiotic, right? So generally speaking, I very rarely wouldn't recommend someone need to take a prebiotic supplement. If they're having the Super 6, you're going to get enough of those certain types of fertilizers for your microbes, right?
So save your money, eat your prebiotics.
Yeah, exactly. Easy to get. Probiotics is actually what I did my PhD in. So it's one where I feel very passionate about. And I think there's just so much disconnect between what all the scientists, and we actually have international health bodies saying certain things about probiotics, yet what kind of the industry and the market and what social media, is suggesting, right?
Yeah.
So there is no clinical evidence that taking a probiotic supplement is going to help with your general gut health.
Okay.
Right? To improve your general gut health, you eat the Super 6. You have fermented foods, so things like your kefir and your kimchi and your sauerkraut. There's been studies showing that has a benefit. And you watch how much ultra-processed food you have. So we know that those sorts of things can help with your general gut health. Don't take a supplement, the probiotic. It sounds like it will help, but it's like a drop in the ocean, right? But that's not to say probiotics don't work. In fact, they can be so incredibly powerful and therapeutic, right? So like I said, these international health authorities say that if you go on antibiotics for whatever reason, then you should take a specific type of probiotic. So we call probiotics, the individual types, a strain, which is a scientific name. And the strain is LGG. And the health bodies say that we should take that throughout our antibiotic period at 10 billion units twice a day.
Yeah.
Now, I know that sounds quite prescriptive and confusing, but it's the same with if someone has iron deficiency, you don't go and give them a vitamin D supplement, expect their iron deficiency to improve, because they're different things. The same goes with probiotics. They're all, each strain, each type of bacteria, each type of probiotic does different things. So we need to be very specific about what we're doing in that space. And, we've spoken about thrush before. And again, we want to make sure there's been, clinical trials showing that those specific types of microbes together, the formulations, can actually reduce things like recurrence of thrush.
Yeah, it's so interesting because I don't know how many times I had thrush growing up, and I'd be like, I'll just get a probiotic, that'll help it, but it's probably money down the drain, because unless it was the right one, it's like going to the salon and saying, oh, can I get blonde in my hair, and they've decided to just put orange in instead. You're like, it's not what I asked for. So there's really intelligent ways that you can manage your health and specific probiotics that you should be taking. I know that you started something really cool called Smart Strains, and it's specific probiotics for specific reasons. So which types do you have?
Yeah, absolutely. And I mean, again, that's where it's like we have these health bodies, these guidelines saying we should take this formulation for this reason.
Yeah.
Formulation never exists on the market. So like, I did not want to start a business at all. I was like, I'm a scientist, but I was like seeing people in clinic and I'm like, I know that this formulation can help them because, you know, we've got the clinical trials, these randomized placebo controlled to take out like, you know, placebo effect. Formulation didn't exist. I was like, I can't give this to the person. So that's kind of the reason for Smart Strains. So in terms of the key areas, so one is for when you're on antibiotics with that LGG strain, your immune system, so things like cold and flu, vaginal infections like bacterial vaginosis and thrush, and colicky babies as well.
So cool. Because I know I'm such a stalker of your Instagram, and you went on a holiday and you were taking the immune one before going to like prevent catching anything or help with that, right?
Yeah. So my little boys are on it constantly because nursery. Yeah. And actually one of the clinical trials showed that the combination of the strains LGG and BB12, which is what's in that one, significantly reduces recurrence of, you know, cold and flu infection stuff in nursery kids, but also in adults. So one of the studies, again, using that formulation of those two strains in adults showed that not only did it reduce compared to placebo, so remember placebo was a fake intervention, so really robust study. So they were blinded. They didn't know whether they're having the probiotic or a placebo. Because we know placebo effect works around 30% of people, right? Because up here is really powerful.
So cool.
Yeah. So the placebo or that, you know, that combination of those microbes, and actually those in with the really active one, they had a reduction in duration of cold and flu by 2 days, and severity of their symptoms were reduced by around just over 30% compared to the placebo.
Oh my God, that's huge.
Yeah. I mean, anyone who's sick, like 2 extra days off work, like that's, you know, pretty game changing. So I think that's the whole concept, is that we need to, there is no silver bullet for our gut health, but we need to use the science. And the science is saying that actually for some indications, they can be really powerful. But then there's other things like, you know, vitamin D, endometriosis. There was a study showing that actually making sure you're getting your vitamin D really beneficial, right? It can reduce, it's been associated with reducing things like pelvic pain. If you're deficient, adding that in. Omega-3s, if you're not getting your 2 oily fish in a week, which it is best to get it from diet, like the studies show it's more powerful, but if you can't, having an omega-3 supplement can be really helpful. But so there are areas where, you know, I'm definitely food first, but we know certain supplements can help. But otherwise, this kind of concept of just taking one for the sake of it and not being specific can waste your time, but also can actually be potentially harmful for your body if you're kind of throwing things in it doesn't need.
Yeah, it's so interesting. And a lot of people, well, I used to think like this as well, where they were like, oh, back in the old days, the caveman days, we didn't supplement and we were fine then. And I was like, yeah, we also weren't so stressed. We weren't traveling so much. We weren't around so many people. So I do believe exactly the same, food first. But if you need the supplement, take the right one.
And also we didn't live as long back then.
Yeah.
So let's be honest about that. So
yeah, that's true. We'll probably make it to 40 if we're lucky. Just so depressing. Yeah. So we've done a little bit of myth busting. I'd like to do more with you. So some of these I think might be true. Some of them aren't. So I'm interested to see what your take is. One of them is that we should completely avoid gluten and dairy altogether forever. Yeah. What are your thoughts on that?
So definitely myth to bust, right? So let's look at them separately. So gluten. So if you have celiac disease, and that's an autoimmune condition, your body literally thinks that gluten is the enemy. It's a toxin. Yeah. And if you have it, it starts to make your body attack itself. Okay. So we know that if you've got this autoimmune condition, you have to completely cut out all gluten. Yeah. Now, there's also a small percentage of people who have what we call non-celiac gluten sensitivity, which essentially is like a gluten intolerance. The number of people that affects is more around like maybe 3 up to potentially 6% of the population. Certainly not near the number of people that are reporting issues. Yeah. So what I would say is gluten is not the toxin we've been led to believe, right? It's a protein. And what we actually see is that a lot of the gluten-free alternatives to foods have got less fibre, more additives, and more fat in it, right? So a lot of people are thinking they're doing the healthy thing, switching to gluten-free, and they're actually having more, low nutritious foods in their diet, right? And there's actually been studies out there showing, excluding those with celiac disease, those who cut out gluten, or those with the lowest gluten intake, seem to have, higher risk of things like type 2 diabetes and reduced diversity of their microbes. The reason for that is not that gluten is necessarily like an amazing prebiotic or anything, but it's just that if you're cutting out things like barley, rye and wheat, they do contain different types of fertilizers that feed your microbiome and can be really anti-inflammatory, right? So I would say anyone who is cutting out gluten, firstly, before you cut out gluten, you should always check for celiac disease, and therefore you need to be including gluten in your diet, right?
Yeah.
So just quickly go to the doctor, get a blood test. If you've already cut out gluten, that blood test will be a false negative. So there's no benefit to that. So always do that, because actually there's like 500,000 people living in the UK with undiagnosed celiac disease.
My mum's a celiac.
Is she?
Yeah, she went undiagnosed for years, was just chronically anemic. Really bad. Really bad.
Have you been checked as well?
Yeah, so I have, and it's never flagged up that I've had celiac disease, but I've always been told I have a sensitivity to it.
Okay.
So I go through periods where I have a little bit here and there, and it'll normally be something like sourdough, for example, which has slightly less gluten in.
Yeah. Anyone who decides to go gluten-free, for whatever reason, right? I think it's really important that you do still focus on one of those, the whole grain group, right? Yeah. Just have your quinoa and your buckwheat. So make sure you're still getting the whole grains in that you otherwise would be excluding. Yeah. And then, of course, if you think you're intolerant, sadly, there is no blood test for it. Yes, there's a blood test for celiac disease, but not for intolerance. So the way that we would do it in clinic is if you see an association with it, with gluten, for example, then you would cut out for a couple of weeks, see how you feel. If you feel better, you would then still need to do a blinded reintroduction to make sure it definitely was that. Yeah. So what you would do, getting very specific, but you would get someone in your house to give you either gluten-containing bread or gluten-free bread. I know they taste quite different, so you would toast them or blend them, put them in a pasta so you wouldn't actually be able to taste the difference. Yeah. So 1 week or for 4 weeks, you would have maybe one slice of the gluten-containing bread each day. And then the following 4 weeks, you would report your symptoms. And then the following 4 weeks, you would have the gluten-free version. And you would see which one made you feel better. And the reason why it needs to be blinded is because there's this thing called the nocebo effect, which essentially is if you think something, like your brain is telling you that something is harmful for you, you physically get symptoms. We see in clinic, and in clinical trials all the time, right? And it's not because you're crazy. I feel like we need to say it's not these people are crazy. It's the fact that your body is so protective. If you get food poisoning to a dodgy Chinese, often you can never eat Chinese. The look of that makes you bleh. Yeah. Because your body is protecting you. So I don't want people to think I've got the nocebo effect and therefore I'm crazy. It's not that. No. It's just you need to be aware, you need to eliminate it. And that's why we do blinded studies.
So interesting, because the anti-inflammatory book talks about how all of the recipes are gluten and dairy free, but that's not because gluten and dairy is bad. It's because sometimes you need to cut them out to, exactly like you just said, reintroduce them and see how you feel with them. And it brings me on to the second thing that I want to talk about. And you sort of mentioned it a little bit about how if you've got an autoimmune condition or, for example, endometriosis, which has almost all the hallmarks of an autoimmune condition, are you going to have naturally a more sensitive gut, and can you still repair it?
Yeah, very interesting one. So we do know that people with endometriosis are 2 to 3 times more likely to also have IBS. Yeah. So there's a strong overlap there.
Okay, and what is IBS? Because I feel like it's like a term. It's like, oh, you've got a random tummy issue, slap IBS on it.
So the underlying mechanism is it's this dysfunction between the gut and the brain. So everyone's gut and brain, like we said, is constantly speaking. If you've got IBS, we know that communication is dysregulated. It's dysfunctional. Okay. So anything that would make someone's gut move a bit, if you've got IBS, it's hyper exaggerated. It's like caffeine makes everyone's gut move. If you've got IBS, it's hyper exaggerated.
Okay. So do you mean hyper as in you're probably going to get diarrhea, or just actually either way?
Yeah, either way. Because actually, even if your gut is hyperactive, it could push the food back up there.
So and then you could get constipated.
You could get constipated, right? Yeah. So it's not a case of because it's active, it will come out. Some people obviously got IBS, diarrhea predominant. You can have IBS constipation predominant, or you can have mixed or unspecified where your poop doesn't actually change too much. So 4 different types of IBS. But like I said, so it's this dysfunction between the gut and the brain. And actually there is this diagnostic criteria. It's based on the Rome 4 criteria. So we as clinicians would check whether someone met that criteria for IBS. So you have to have stomach pain at least 1 day a week. And that needs to be associated with pooping in some way. And that has to have occurred for at least 3 months and the onset at least 6 months.
Yeah.
So we do, have this kind of criteria and we see whether someone's met that or not. But before I would ever consider that being kind of the diagnosis, always check for things like celiac disease and inflammatory bowel disease. Again, simple visit to the GP, check off a few things.
And see if it's that.
Yeah.
So interesting. The next one, if you're happy to talk about it, because I know it's all over the internet. So GLP-1s, so Ozempic, Mounjaro. What are your thoughts on them? Because I see there's like a Mounjaro community on TikTok, which kind of scares me a bit. But I'm also happy that people have support if they're going through it. I've heard amazing reviews of people changing their life, saying that, they're losing all their weight, which is, if that's their goal, great. And they're saying it's balancing their hormones. And I'm finding it really confusing because a lot of people are saying, oh, it makes me so constipated. And as someone whose like identity has been constipation their whole life, I'm like, oh my God, get away from me. How is that going to help your hormones? Especially if like you've just taught us today how it regulates in your digestive system. So why are GLP-1s so popular?
Yeah.
Why do some people love them? Why do some people hate them?
Yeah, because essentially that we know that they're very effective at weight management, right?
Yeah.
So they can, one of the main mechanisms is they kind of slow down the digestive system and make you feel more full. So you're not always hungry.
Yeah.
So actually you can have a bite of cake and be like, even though that's my favorite cake, I just can't physically eat anymore, right? So that's kind of one of the things. I know.
Feeling.
Yeah.
Yeah.
So that's essentially what it does. It's kind of like an appetite suppressant. There's a few other mechanisms, but that's one of the key ones. So one of the issues that I've got with these is, again, like you said, can be really beneficial if people are really struggling with weight and they don't have the confidence to go to the gym and stuff. They take it for a short period of time, start to feel better, and then they can start making lifestyle changes. But actually, they're often used in the wrong way, where people are taking them because they don't have much of an appetite. They will just dine on half a croissant, half a chocolate bar, and that's all they have.
So even the tiny bit of food that they're getting isn't the good stuff either.
Exactly. So you actually can become really severely malnourished in terms of, physically you might still look well nourished, but actually you're not getting all your micronutrients, as well as the fact that you're not feeding those microbes.
Yeah.
And we'll remember, or you might not be aware, but anyone listening, is that our microbes actually, when we eat fibre, that can help kind of trigger our natural production of the GLP-1 hormone, right?
Yeah.
So actually having the fibre then can help you with that satiety, feeling full factor. So I'm kind of, I think we just need to be really careful around how they use, and, slow digestive symptoms is one of the most common symptoms that people experience on them.
Yeah.
So it can be really tricky, but, I see the pros and the cons. For some people,
Yeah, I like that you don't shame anyone for going on it, but you're also not like, everyone go get Ozempic.
Yeah.
Because there are probably some people that it's life-saving for, but then there are probably some people that really want the help, and the help they need is actually spoon by spoon increasing the fibre, naturally increasing their GLP-1, because that's the other thing. People are paying between hundreds to thousands of pounds a month on this thing that they might naturally be able to help themselves with at home.
Yeah.
So you're giving people the free Ozempic that they need.
And also it's a long-term effects, right? So if you're in your 30s now, you might be just fixating on right now. But if you're going to have osteoporosis and all these other conditions in your 40s, which means you can't go traveling, you can't look after your kids, you're going to really regret that 30-year-old you, right?
Yeah, and why would that give you osteoporosis?
So things like if you're not getting in your calcium, right? So really malnourished, then you're not going to be, having that reserve, feeding the bones. And that's just one example.
Yeah.
So
what are the best sources of calcium just for everyone? Because I know I don't drink milk, and I don't have milk in a lot of my things because it tends to set my skin off.
Do you have fortified, plant-based milks?
I avoid them mostly because most of them are crap. Plenish, I do like Plenish, to be fair.
Yeah, we know that the bones in salmon is a good source. Yeah.
Okay, interesting.
Yeah. Hard cheeses, do you have?
Yeah, I do like hard cheese.
Yeah.
And as well fish cakes. I love making fish cakes actually.
Yeah,
so salmon always goes into that.
With the bones.
So I'm
eat the bones, yeah.
So many people listening to this will be struggling with their tummies, because that's probably why they found the Finally Found podcast. So for anyone who is like, right, I want to go to the doctor, but maybe they've had a shit experience before. I know I have before. Yeah. I know, meeting so many wonderful doctors, that not all of them are bad guys. So how do you advocate for yourself?
Yeah, look, my husband's an NHS GP, right? So I kind of see both sides, that they literally have 6 minutes to see you, 4 minutes to write up your notes, right? They're so overworked. So what I say to anyone in this situation is go and make it as easy as possible. So like have a symptom diary, have it very clear, your stools, think. They'll ask you questions like, how long have you had these issues? What are your main symptoms? So often people can be quite nervous when they're going to the doctor and they know they've got, not much time. Oh my God, what am I going to say? So like literally write them down, take your answers with you.
Yeah.
And if you have to go back a week later, feel entitled to be able to rebook an appointment because it is really tricky. And I just think the system is not really supporting a lot of chronic conditions because it is only 6 minutes. And like, how can you help someone in 6 minutes? It's like impossible. So I would say not all, I think all doctors went into the profession to do good, to look after people. But being restricted, I think you need to understand where they're coming from. So making their job easier by having the answers written down. And actually, I do have a little checklist. I'll put it maybe in a show notes of the 10 questions to prep. Because I asked my husband, what would you really like?
Yeah.
And I've, got him to write it down and to share that so people can prep before they go.
That is such a good tip because I always say about writing your notes, but sometimes you don't even know what to write. So having those prompts, I think would be so useful. Yeah. Something that really helped me was getting a second opinion because I didn't realize that I was getting the same answer from the same doctor, not realizing that he or she either was just super stressed, super busy all the time, or the other thing I think is really interesting is that if you as a doctor are not interested in that topic, you might not see the symptoms for what they are. You might not connect the dots because it's just not something you're looking for. We talk about confirmation bias.
Yeah.
You've never seen a white Tesla before, but then you buy it and then all of a sudden everyone's got a white Tesla, something whereas if you're interested in gut health, for example, but someone's presenting with different symptoms, your brain might automatically want to go towards gut health. And for me, that was a thing of when I changed doctors, it was 5 years of struggling with the same exact symptoms, just getting worse and worse, didn't get an answer, just asked for a different GP. And he, in the first appointment I ever saw him, went, I think you've got endometriosis. I went to a women's health conference. It was absolutely fascinating. He was excited to talk about it. So it's that thing of don't worry, you can ask for a second opinion.
Yeah, I absolutely love that. You are so entitled for that. And like you said, there is literally hundreds of conditions we expect GPs to know, but they're human, right? They're not going to specialize in all of them.
Yeah.
So even when you're booking your appointment to go, I think, is there a doctor that specializes in this?
Yeah.
Just to, again, kind of have a greater chance that you'll connect with the right medic.
Yeah, with the right person, exactly. Okay, I want to get on to Q&As because I put a story of our podcast up this morning and I had so many messages. So we're going to try and get through a couple of them if that's okay.
Yeah.
Right, so... Oh, this is a good one. We haven't covered magnesium.
Okay.
So they've said, I'm constipated all the time and even my magnesium won't work anymore. What can I do?
Yeah. So I think, again, with supplements like that, your gut can get addicted to them, right? So we know in terms of constipation, psyllium husk we've spoken about before, but can be really laxating fibre. But if you've got a shy bowel and you're not giving it that right environment, no matter what you put into your body, you're just going to shut up, right? So we know that there's this movement called the mass movement, kind of pushes the poop through.
Yeah.
Now that is most active typically in the morning.
Yeah.
And we know that having a little bit of caffeine, doing some gentle exercise, having a bit of carb and fat can actually help get that moving. So think about your morning routine, thinking, can you have some Greek yogurt, maybe a little bit of oats, and then go for a walk around the block, have your coffee. That combination often does kickstart it.
Yeah.
And then even I often say to clients at clinic is, I know it's painful, but sit on the toilet, get in this routine in the morning.
Yeah.
And don't sit on there for ages and push and get it.
Yeah.
But get into this toilet routine
every morning.
Yeah. And it might take 2-3 weeks.
Yeah.
But your body and your bowels are so habitual.
Yeah.
So kind of, even if it means waking up, 45 minutes earlier because you're through the door, having to go to work, all that sort of stuff. Give your gut that time for the bowels to move in the morning.
Yeah, this is so interesting because one thing, I had a message from someone saying, I haven't had a poo in 7 days. I always have a coffee first thing to help it. And I was like, I'm not your doctor. I can't give you any advice, but why have you stopped having your coffee if it was helping you? They said, a naturopath said it was the worst thing in the world and you shouldn't be relying on caffeine. Yeah. So that's just myth.
Yeah, absolutely. So again, this whole coffee thing, we know that can actually be beneficial for some people because it's got these polyphenols in it.
Yeah.
The only issue with coffee is the caffeine for people with sensitive guts, right?
Yeah.
So if you've got IBS diarrhea predominant, that caffeine can make your bowels go like that, right?
Go.
And go explosive. But actually, for a lot of people like IBS, constipation predominant, that can really help things get going.
Yeah.
The other thing about caffeine we know that it does increase your stress hormones, your cortisol. So if you're anxious and having a stressy day, I think 1 is generally fine. But if you're having like 3, 4, then that's when it's not good for you. So it's kind of mixed advice for different people. But this whole concept that it's terrible for everyone is a myth,
And decaf coffee, would that have the same effect?
So, it's not as effective at stimulating the bowels, but they have shown in studies that it does, whether it's the hot nature of it and there's other chemicals in the coffee that might help a little bit. So you can try it, but never going to be as effective as a real coffee.
Interesting. Well, I'm going to stop feeling guilty about my coffee now. Another one that I think is fascinating is, ever since taking the pill, I have constant bowel issues. Does that mean my pill is causing it?
Not necessarily. I think when it comes to the pill, there's just so much happening in the body, right? And we don't know how it's really going to impact everyone.
Yeah.
I would say overall, when we look at these observational studies, there doesn't seem to be a link between the pill and gut issues. But it is one that anecdotally often people report, but then when they've done the actual studies and taken out bias, it doesn't seem to cause it.
So maybe it's a case of keeping a journal as well to see if there's some lifestyle
exactly, and talk to your doctor whether you can change the type of pill that you're on as well.
Yeah, okay. I get thrush every month just before my period. Why is this happening and how do I fix it?
Yeah, so when we think about thrush in terms of there's this change in the vaginal microbiome, so we know that the group of bacteria called lactobacillus is really helpful at kind of protecting from overgrowth of the candida, so a type of yeast, right? So often when you get your periods, the estrogen and progesterone, obviously those hormones all change, and that can change how the lactobacillus works.
Yeah.
So like we alluded to before, there's actually been clinical trials that shows alongside an antifungal, taking the specific type of strain, so that's the LA14 plus HNO1 with lactoferrin, that's the formulation, has shown to significantly reduce recurrence of thrush compared to placebo. So definitely worth considering.
So cool. And as an FYI, a friend of mine, I feel like I'm like the vagina girl where everyone just messages me like, what do I do in this case? And my friend said exactly this. And I ordered 3 months of your smart strains and sent it to her. And she said she's feeling a lot better.
I'd love to hear that.
Cool.
Brilliant.
Very cool. There's a closing tradition on the podcast. Ooh. I would love to know, what is the one thing you found on your personal journey that you've gone, thank God I finally found this and I want someone else to do it too?
I would say targeted probiotics. Like I really think when used in the right way, can be so powerful and so game changing.
Yeah, I love that. Thank you. It's no surprise as well. And I think the fact you've brought out a supplement which you actively are putting your children on says a lot about the quality.
Live and breathe it.
The quality of that supplement, because I'm big into the type of supplements that we take. So thank you for making such an amazing supplement. And thank you for coming on this podcast. Honestly, I have been obsessed with you since we met at that M&S event. So thank you, M&S, for bringing us together.
It's been an absolute pleasure.
Thank you. And how do people find you?
So I'm at The Gut Health Doctor, so social and online.
And you have a book?
I've got 2 books.
Two books.
Eat Self Healthy and Eat More, Live Well.
Amazing. We'll make sure to put the links to everything in the show notes. Thank you so much. And hopefully we'll have you again for season 2.
Yeah, absolutely. Bring it on.
Thank you so much for listening to our gut health episode. If this has been genuinely helpful for you, please can you leave a review, like, comment and follow on whatever platform you're listening or watching on. And if there's a women's health topic that you want to learn more about or you're passionate about, please drop me a DM because we'll make sure we'll find a guest and explore it with you on another episode. Be sure to follow us on the Found socials, which is at found.thebrand across Instagram and TikTok. So until next time, keep tuning into your body because your gut instinct is always right.